continuing the series of general physical examination, that is PICL. Today we will discuss about edema. So mainly, what is edema? Definition is excessive accumulation of fluid, tissue in subcutaneous planes or serous spaces, serous sacs. This is the definition of edema, and whenever we observe edema in any patient, we have to first differentiate whether it is pitting or non-pitting. So pitting versus non-pitting edema. Here, what we usually do is commonly over the legs. So over medial malleolus or slightly above there, above the medial malleolus or over the shin of tibia, we have to give a firm pressure using the thumb. So usually for about 5 seconds, and look for any dip or pitting. So if there is formation of the dip, which will refill gradually, like the fluid will redistributed to that particular site, it is called as pitting. Suppose there is no displacement of the fluid or tissue and there is only duffy feel, we consider it as non-pitting type of edema. So this is mainly because of the fluid accumulation, whereas non-pitting edema might be because of excessive mucinous substance or protein rich substance, some other soft tissue. Coming to the causes of pitting edema, we all know that cardiac failure, congestive cardiac failure, then nephrotic syndrome and cirrhosis, low protein, hypoproteinemia, even the venous obstruction. Whereas non-pitting edema, we can consider mixed edema, in which mucinous substance will accumulate causing edema. Then lymphatic obstructions such as filariasis, which will lead to protein rich substance accumulation, and we can consider even angioneurotic edema of anaphylaxis. Then, as we told, soft tissue, we can consider some connective tissue diseases like MCTD, mixed connective tissue disease, or even scleroderma, in which there will be duffy feel of the skin. So these are some causes of pitting and non-pitting edema. And one more thing here is, what are the causes of unilateral edema? So mainly cellulitis or venous obstructions, even deep vein thrombosis or trauma or fractures, hemiplegia, lymphatic obstruction. These are some causes of unilateral edema, which we have to know while dealing with edema during examination. And one more thing in edema is the pattern of progression of the edema is very important pattern to get the clue about the disease. For example, in cardiac failure, suppose it is cardiac related edema, first we will see edema in the dependent areas, mainly legs, then face might be involved, then ascites or abdominal edema we can see. Whereas in renal, there will be appearance of facial puffiness first, then there will be legs edema, then there might be ascites. At the end, it might lead to anasarca. Anasarca is generalized edema. Whereas in cirrhosis of liver, there will be ascites, then legs, then face might involve. So these patterns in history will help us to find out the cause or which system is the reason for edema. This one we should consider. So this is all about edema.